The walking gallery began in 2011. It was a concept that if we could paint the patient's story on our backs and walk as docents of our own lives, we could spread the word in a movement. And there are hundreds of us now.
Another patient accident. It's the second annual patient accident.
I am so glad to give you your jacket. It's spectacular and it matches you. The walking gallery is a movement, so we're looking for more people who'd walk and more artists who'd paint, and we are looking for artists who want to paint other people's stories as well as their own.
Just being at the walking gallery is so powerful because you are surrounded by people who have a painful or powerful moment in their lives painted on their backs. It's fabulous that I know that there are people elsewhere in this country that are walking around wearing my work. It's really cool.
We're going to use Vine as our default recording of choice. All right, my name is Fred Trotter, and I have an upside-down world on my jacket because I want to use open data to turn healthcare upside down.
My jacket's about diabetes busters. I got it from the idea of Ghostbusters.
Okay, we're good.
Hi, I'm Wendy Dombrowski. My jacket's about I love old people and helping them stay healthy so they can sing and dance.
My name is Lindsay Hoggle. The name of my jacket is Rainbows and Butterflies, and it tells the story of my family, 2 parents, 4 children, and 3 grandchildren. And
Hi, I'm Elisa. The title of my jacket is No Small Matter. The ultimate act of patient autonomy is to have an advance plan, write it down, and talk to your family. My brother saved 4 lives through organ donation.
It represents the 3 rings of the Holy Trinity. I'm a 30-year, 3-time cancer survivor, and I also walk by faith. So what I've learned over the course of my life as a survivor is with each diagnosis, I've become more engaged, informed, and empowered as a patient. To really bring life to the stories that we all have is incredibly powerful and meaningful and moving.
When I was 5, I lost 50% of function in my left kidney, so I have to hydrate a lot more than anyone else would. I love Minecraft, and that's exactly what this is, so it's kind of cool.
The story of my jacket is about my daughter Sophia, who had a rare genetic metabolic disorder called Niemann-Pick type A. It's actually from a narrative scrapbook that I actually created to help me support her end-of-life care. And so my husband selected it as a piece that he wanted to paint on the back. So my walking gallery jacket was painted by my husband, Richard Sachs.
Gimme, it's mine. Gimme my damn data. It's all about me, so it's mine. One more time now. Gimme my damn data. It's all about me, so it's mine.
The walking gallery is growing. We are at community events throughout the world, but also we are showing up at medical conferences and policy meetings and changing health policy and making it patient-centric. People are seeing the stories of lives on backs.
A friend or a member of their family, and that data is all being published online. And critically, what we are discovering is that if you ask the staff of hospitals whether they would want their own friends and family to be treated in their own hospital,
We do all kinds of innovative things. We're one of the leading companies in terms of care management.
For Health Data Palooza 4. This is pretty exciting. This is widely acknowledged.
It was actually this time last year at the Data Palooza. While walking up to the conference, I saw these people with jackets, and to be honest, the people I were with were saying, what are those jackets? I actually met Tiffany, and she was wearing her jacket. And she told me about the walking gallery, and she described her patient story by turning around and walking me through her painting on her back.
Hi, Jerry.
How are you?
Oh, hey. You got your jacket?
I do.
Oh,
I do.
Excellent. I cannot wait to paint on it. This is spectacular.
It's an honor for you to paint on it. But since then, I was immediately touched by the power of the gallery and the power of the story behind it and the power to connect people.
What's neat about wearing the jacket is that it helps us, particularly as policymakers, to connect the policies that we're working on and what we do in our professional lives to our personal experiences.
The power of the walking gallery in a situation where I'm the only person wearing a jacket or one of a few instead of one of many, it's a great opportunity to sort of begin the conversation with more people than I would otherwise have a chance to.
I had a brother who passed away of AIDS in 1995. It's not a super easy thing for me to share that publicly, but through the trust in the gallery and seeing the stories that other people have in their jackets, it is a very connecting thing. You feel comfortable when you're talking to someone. It's easy to say, look, this represents something that's important to me. And we don't always do that. Frankly, the beauty of the walking gallery, I think, is that everybody has a story.